Our final speaker for the day is Art Cooper, another individual I've worked with well over 20 years in this particular area. And Dr. Cooper has been extremely experienced in so many aspects of disaster medicine and public health preparedness. One of the things that Ray was covering is obviously professional development as part of the formal development educational system. The other giant area out there is continuing education. And where does it come from? Who provides it? Is there any consistency and commonality in those kinds of available programs? We have them in the private sector. We have them in the public sector. Dr. Cooper is going to give us a snapshot of probably the most successful in the private sector and some of the programs available in the government sector. And with that, Art, I will let you tell everyone what that list of alphabet soup acronyms translates into.
All right. It's my pleasure to be with you here today. I share with my friend and colleague of so many years, Ray Swinton, the honor of participating in this program with so many incredibly learned and forward-thinking folks in the field of disaster medicine. And of course, we all are grateful to the General, Jim James, for calling us all together and getting the society moving again. Ray Swinton, during the last few minutes, shared with you a vision of how to educate, train, recognize, if you will, the future leaders of disaster medicine and public health on a global level. My task during the next few minutes is really to bring this down to ground level, if you will, and really survey the programs that are already in place that will allow those interested in disaster medicine to gain a broader understanding of the content in this area, and of course to allow themselves to become, if you will, holders of that secondary specialty certificate about which Dr. James has been talking, that disaster medicine needs to be every health professional's second specialty. Next slide. So I'm going to begin just by reviewing the really key partners that have really made major contributions in the area of disaster education and training in the United States. Obviously, the Assistant Secretary for Preparedness and Response in 2015 established Tracy, which is an extraordinary information gateway that is an incredibly robust resource on so many subjects in disaster medicine. I'll review those briefly in a few moments. We're then going to talk about the Federal Emergency Management Agency, which, of course, has made training programs available both in person and online for so many years. And finish up that section of the survey with a review of the programs of the Center for Domestic Preparedness housed at Anniston, Alabama, where folks can go for really in-depth, hands-on, personal training opportunities that will really, really ramp up their skills. And last but not least, near and dear to my heart, is a brief discussion of the programs that are offered by the National Disaster Life Support Foundation. These are now available for the most part, online, and will allow the basic knowledge and education in the medical disaster response to be disseminated broadly. I'll state for the record, I have no personal financial conflicts of interest. Like all of us here, I'm a volunteer and do this because it's important work that has to be done. I am, of course, the chair of the National Disaster Life Support Foundation and believe in its programs. I suppose that might be a fiduciary conflict of interest, but I would see it more as a congruence of interest rather than a conflict. Next slide, please. Now, I've organized this talk around screenshots from the various organizations that I mentioned, primarily so that when you call them up through your own Google search, you'll recognize them instantly. And you can see at the top of the slide, askfortracy.hhs.gov is the website. That will bring you to this homepage. And the homepage leads you to about a 2-minute video on what Ask for Tracy has accomplished since 2015, just in 6 short years. Next slide, please. Ask for Tracy has divided itself into a series of domains focusing on technical resources. It has an assistance center that provides access to technical assistance specialists for one-on-one support. And then there's an information exchange, which comprises a user-restricted peer-to-peer discussion board that allows open discussion in near real time. And here on the right side, you can see all the resources that Ask for Tracy has put together, focusing on a myriad of subjects in disaster health, all of which I think in one way or another we've touched on during this day's presentation. Next slide, please. And just to give you an example of the technical resources that Tracy has made available, look at this phenomenal list of topic collections that Tracy has put together. Access and functional needs, active shooter and explosives, blood and blood products, burns, and then on down the list. Huge resource for anybody interested in disaster health broadly defined and disaster medicine more narrowly defined. Next slide, please. This is a screenshot for its assistance center. They make it so incredibly easy. You can contact them online. You can call them, and then you can do a direct question ask, as you can see on the right-hand slide, with a little @ symbol inside the little house. Next slide. And then finally, the information exchange. This will allow those of you who are interested in uploading information about your own programs, to let others in the world know what you're doing, what you've accomplished, and really involve an active discussion with peers throughout the nation and the world as to how we can do this job better. Next slide, please. Just recently, not part of Tracy, but the Assistant Secretary for Preparedness and Response has funded a whole series of centers to improve disaster response resources and education and training. I highlight here the Southern Regional Disaster Response System. I say that I highlight it only because the National Disaster Life Support Foundation has the honor of participating in this consortium. You can see the partners listed there, but we expect big things from this consortium as we move forward to help enhance the educational and training resources that ASPR already has made available through Tracy, among other programs. Next slide, please. Moving on to the Federal Emergency Management Agency program. You can see the website listed at the top right, training.fema.gov. This is the web page that you'll see when you go to that website. There are basically 3 major divisions: the Center for Domestic Preparedness, that we'll talk about shortly, the Emergency Management Institute, which provides not only online but also on-site training programs in the basic emergency management skills. And then, of course, the National Training and Education Division, which serves state, local, and tribal entities in 10 professional disciplines. You can see at the top of this website that there's an extensive online course catalog that will get you to where you need to go. Next slide, please. All aspects of emergency management. Here's the website for the the training center. Next slide, please. And just all of you should be familiar with the programs that are offered by the EMI. Look at this incredible list of catalogs, all of them available online for free, courtesy of our colleagues as American taxpayers. Next slide, please. And of course, I'd be remiss if I didn't remind everyone that, particularly those who are located in the United States of America, of the key programs that all of us should be aware of. Introduction to Incident Command, Basic Incident Command System for Initial Response, and of course, all based on the National Incident Management System and the National Response Framework, introductions to which are described in programs IS 700 and 800. Every emergency provider in America should have participated in these programs and understand how the American disaster response system works. Next slide, please. Now, moving on to Anniston, Alabama, where the Center for Domestic Preparedness, you can see its website listed there, offers hands-on training courses under the auspices of the Leidos Corporation, which staffs the Anniston facility. Next slide, please. Okay, and here's the motto: the mission is to train the best for the worst, to identify, develop, test, and deliver training to state, local, tribal, and territorial emergency response providers through on-site, mobile, virtual training, et cetera, by training partners, not only through the CDP, but also the Department of Homeland Security. Next slide, please. And here are examples of the all hazards training that are provided, and some of the circumstances in which such training would have been useful. Certainly the Pulse nightclub shooting and bombing in Orlando, Virginia Beach, Kenosha, Wisconsin, just recently, Portland, Oregon, recently, Hurricane Michael, California wildland fires that we heard about this morning from Asha Devereaux, the COVID-19 pandemic national response, and of course, going even back as far as the Boston Marathon bombing and the Sandy Hook school shooting, and of course, most recently, the school shootings in Oxford, Michigan, which break our hearts again every time they occur. Next slide, please. The CDP training categories are resident training. You go down there and you spend a week. Non-resident training, there's expeditionary training, academy training, virtual training. Visit the website to learn about all these different opportunities. And look at that, over nearly 1.2 million people trained through that facility as of 30 September 2021. Next slide, please. And last but not least, again, near and dear to my heart, the programs offered by the National Disaster Life Support Foundation. This foundation was jointly founded by the University, what is now called Augusta University, which is part of the Georgia Region System, and the University of Texas Southwestern. As Jim James mentioned, Ray Swinton's been involved with this from the get-go. And I speak, of course, on behalf also of the Georgia group, which is headed by Richard Schwartz. You can see listed down the left-hand side of the slide the various courses that are offered. Next slide, please. Domestically, these courses are offered in 91 domestic NDLS certified training centers. Next slide, please. And now in 37 international NDLS certified training centers. And as you can see from the logo at the bottom right, which I of course, am proud of, very, you can see that it's an all hazards response, radiation, infection, bombings, chemicals, and of course, active threat events. Next slide, please. Incredible growth. We've trained over 250,000 folks worldwide. Excuse me, I've just lost my screen. One second, please. I apologize. Over 250,000 certifications issued around the globe, and in most years, over 7,000 students participate in our programs. And even during the pandemic, many courses continue to be conducted virtually. And as of this year, we're on track to reach nearly 6,000 participants, again, ideally in online and in person. Next slide, please. So we start at the community level. Community disaster life support is a competency-based awareness level course providing participants from various professions, disciplines, and backgrounds with a common lexicon, vocabulary, and knowledge in disaster disaster-related medicine and public health. It introduces a number of concepts, including the disaster paradigm that does include pre-work as well as some NDLS video content. Next slide, please. The Essentials of Disaster Life Support is an online virtual course for 4 credit hours that focuses on NDLS core concepts and can serve as the prerequisite for the second half of the Basic Disaster Life Support or BDLS certification. This is ideal for students in healthcare and emergency management degree programs to fill the void of disaster preparedness curricula, which hasn't been mentioned so many times, rarely is included in most health professional curricula to date. And over 500 students have completed beta tests of these materials, and this course is now available to be utilized online. Next slide. Basic Disaster Life Support is a new 2-part course, which focuses on the pre-work, which is identical to the EDLS course. And then there are 5 in-class scenarios that are facilitated by NDLS instructors. The course provides 8 hours of CME credit, the 4 hours of pre-work, meaning EDLS, plus 4 hours of in-class scenarios. Next slide. This will be available to you very early next year. We have also focused on coordinators at the hospital level, emergency healthcare coordinators, and we have, of course, the Certified Healthcare Emergency Coordinator course, which has transitioned from hospital focus to healthcare facility focus. It's a 2-day classroom-based course, which provides students with an introduction to emergency management principles. There's an advanced 1-day program that follows on that gives the opportunities, give the students the opportunities to really immerse themselves in what they learned in the basic program. We anticipate that within the next several months, at least the 2-day basic course will be transitioned to an online program as well. Next slide, please. So please keep in mind that all the important education and training resources that are currently offered are available either for free or for a very nominal fee. We thank all of you for your efforts. I applaud the efforts of Professor Swinton to get the experts, of the future ready to take on that task. I applaud all the prior speakers who've given us many, many directions on which to focus. But I think we all need to recognize that we all stand on the shoulders of giants. And again, I applaud the my predecessors in the NDLSF program out of the now what's called Augusta University and the University of Texas Southwestern, who originally put together the first set of NDLSF courses. And I think it's now time for me to turn this back to Jim James. I hope I stayed within my time frame. And Jim, it's an honor to join with the others in speaking today. And at your direction, we'll be happy to answer any questions that anyone may have. Thank you so much.